She'd been working the night shift in the ER for 15 years, just a quiet nurse who never raised her voice, never questioned orders, until the mass casualty event when the doctors froze, and she took command with the precision of someone who'd stitched wounds under mortar fire. Welcome to Hidden Legends. Before we begin this powerful story of courage, skill, and forgotten heroism, tell me in the comments where you're watching from today. And if you believe stories like this need to be heard, hit that subscribe button and help us make sure they are. Memorial Hospital's emergency room never stopped. Patients flowing day and night, doctors rushing around, ambulance sirens screaming constantly. And in the middle of this chaos, there was a woman moving quietly. Sarah Mitchell, 15-year hospital nurse, 42 years old, short brown hair, always with a calm expression. Sarah's shift started at 11 p.m. and ended at 7 a.m. The hardest hours, the most critical cases, the least staff. But she never complained. She quietly followed doctors' orders, gently calmed patients, spoke to families with a soft voice. Everyone knew her as Reliable Sarah. Other nurses found her a bit boring. She never gossiped about hospital drama, never told stories while drinking coffee in break rooms. She just did her job, then quietly went home when her shift ended. She never shared anything about her private life. Married, kids, where was she from? Nobody knew. Dr. James Rodriguez, the ER chief, appreciated Sarah but didn't really notice her. To him, Sarah was a good nurse, reliable, flawless, quiet. Exactly the kind of team member he wanted. But he never questioned the precision in Sarah's movements, the intuition she showed when approaching trauma patients, or why she never panicked during stressful moments. Young Dr. Michael Chen was different. He'd been working at the hospital for 2 years, trying to gain experience in emergency medicine. Michael enjoyed observing Sarah. He thought he learned a lot from her, but sometimes he noticed strange details. Sarah's hands never trembled. She stayed calm even in the most chaotic moments. The terminology she used when evaluating trauma patients was sometimes very technical. And, strangest of all, she had a faint but noticeable scar on her arm. Michael was curious but never dared to ask. That Friday night changed everything. It was 2:47 a.m. Sarah was doing routine checks. The ER was relatively quiet. Only a few patients, an elderly man with flu complaints, a young woman with a sprained ankle, a middle-aged man with chest pain. Dr. Rodriguez was on duty with 2 resident doctors. Then ambulance sirens were heard, not just one, but several, one after another. The first reports started coming over the ambulance radio. Memorial Hospital, multiple vehicle accident, at least 15 injured coming, will be there in 5 minutes. Dr. Rodriguez immediately sprang into action. Prepare the trauma rooms. Call all personnel. This is a mass casualty event. Hospital protocols kicked in. Emergency was declared. All available personnel were called, but the night shift had limited staff. Dr. Rodriguez, 2 resident doctors, 3 nurses, and a few technicians. The first ambulance arrived. Inside was an unconscious woman with deep chest wounds. Second ambulance, a young man with a crushed leg. Third, a child with head injuries. Fourth, fifth, sixth. The injured kept coming. The ER instantly turned into a battlefield. Blood, screams rushing around. Dr. Rodriguez was shouting orders, residents were running around in panic, nurses were trying to help as much as they could. But the numbers were too high. 15 severely injured, 3 doctors, limited equipment, and the most critical cases were arriving simultaneously. While Dr. Rodriguez focused on the most severe case, the child patient was in crisis. The resident doctor didn't know what to do. Other nurses were divided among too many patients. That's when Sarah stepped in. Dr. Chen, she said, her voice calm but authoritative. I'm taking this patient. You focus on that chest trauma. Michael was surprised. Sarah would never give orders like that, but there was no time to argue at that moment. Sarah went to the injured child, 8 years old, bleeding from the head, low pulse, critical condition. Sarah put her hands on the child's head, examined the wounds. Skull fracture, she said to herself, but no signs of intracranial bleeding, needs immediate cleaning. Sarah's hands began moving with surgical precision. She cleaned the wound, controlled the bleeding, stabilized the child's vital signs. Her movements, the techniques she used, these weren't ordinary nursing procedures. Michael was observing from the corner of his eye. Sarah was moving as if she were working on a battlefield, fast, effective, precise. "Nurse Mitchell!" Dr. Rodriguez shouted. "I need help here." Sarah ran over after stabilizing the child. The patient Dr. Rodriguez was dealing with was a young woman with a deep stab wound in her chest, heavy blood loss, pulse dropping. "She needs immediate surgery," Dr. Rodriguez said, "but the operating room isn't ready. We'll have to wait at least 10 minutes. "She can't wait that long," Sarah said, examining the patient. "She has bleeding in her lung. Immediate intervention required." Dr. Rodriguez was surprised. "Sarah, you're a nurse. You can't make diagnoses." But Sarah wasn't listening to him. She put her hands on the patient's chest, checked her pulse, observed her breathing pattern. "Tension pneumothorax," she said definitively. "Immediate decompression needed. Otherwise, we'll lose her in 5 minutes." Dr. Rodriguez hesitated. Sarah's diagnosis was correct, but for a nurse to speak so definitively. "I'm going to do needle decompression," Sarah said, heading to the equipment table. "Sarah, you can't perform that procedure," Dr. Rodriguez protested, but Sarah had stopped. She placed the needle in her hand into the patient's chest at exactly the right angle, at exactly the right depth. A sound came, the sound of pressurized air escaping. The patient's breathing immediately improved. Everyone in the ER froze. Sarah had performed this procedure perfectly, an intervention that only experienced emergency doctors could perform. How did you?" Dr. Rodriguez asked, his voice full of amazement. Sarah looked at him. For the first time in 15 years, there was a different expression in her eyes. She was no longer just an ordinary nurse. She was something else. "Because this isn't the third time I've done this," she said calmly. "Afghanistan, Iraq, and now here." Silence fell. The chaos of the ER stopped for a moment. "Afghanistan?" Michael asked. Sarah answered while keeping her hands on the patient. "Army Medical Corps, 2005 to 2010, 3 tours, forward surgical team." Dr. Rodriguez's mouth fell open. Forward surgical team, elite medical personnel working on the front lines, operating under the most difficult conditions on the most critical cases. "But you're a nurse," Dr. Rodriguez stammered. "In the military field, we were nurse, surgical assistant, and combat medic," Sarah explained, continuing to stabilize her patient. "Because to come back alive from there, we had to know everything." It occurred to Michael. The scar on her arm. "Shrapnel?" he asked, looking at Sarah's arm. Sarah nodded. "Kandahar, 2008. We were operating on 4 wounded soldiers during a mortar attack. The tent was hit. 3 people were wounded, including me. But we finished the surgeries." At that moment, hospital director Dr. Patricia Williams came running. "What's happening here? Why has everyone stopped?" Dr. Rodriguez didn't know what to say. Sarah took over and explained. "Doctor Williams, we have a mass casualty situation. 15 severely injured. We're insufficient with our current staff. If you'll allow me, I can take coordination." "Who are you?" Dr. Williams asked. "Sarah Mitchell, nurse, but also former Army Medical Corps." Dr. Williams hesitated. This was a protocol violation. But patients were fighting for their lives. Sarah didn't wait for her decision. She turned around and shouted to the ER, "We're going to do patient triage. Red, immediate intervention. Yellow, stable but monitoring. Green, minor injuries. Michael, you take the reds. Janet, yellows. Tom, greens. Dr. Rodriguez, you handle the most severe case. I'm coordinating." And something incredible happened. Everyone followed Sarah's orders. Sarah began walking around the ER, evaluating each patient in 30 seconds, determining priority order. As she moved, her demeanor changed. She was no longer the quiet nurse, but a medical officer trained on the battlefield. "This patient is in hypotension," she said, pointing to an injured person. "Immediate IV fluids. This patient has internal bleeding, surgery within 10 minutes. This child is stable, but check every 2 hours." The team organized around Sarah. Everyone knew what to do. Chaos turned to order. For the next 4 hours, Sarah directed the ER with military precision. Every patient was treated appropriately. Blood banks were coordinated, surgery schedules were optimized, families were given regular updates, and no one was lost. 15 severely injured, 15 saved patients. At 6 a.m., when the last patient was stabilized, Dr. Rodriguez approached Sarah. "Sarah, tonight you were incredible. I've never seen medical management like that." Sarah smiled, beginning to return to her old self. "Thank you, Dr. Rodriguez. I just did what needed to be done." "But why? I mean, why didn't you ever mention it? You've been working here for 15 years. I never knew you were so talented." Sarah stopped. "Because I didn't come here to fight. I came to serve in peace." Battlefield Sarah and Hospital Sarah are different people, Michael approached, but tonight they became one. "Yes," Sarah admitted. "Because there was a need," Dr. Williams joined them. "Sarah, I need to talk to you. What you did tonight, it was against protocol, but the results were incredible." Sarah nodded. "I understand. I didn't follow the rules." "No," Dr. Williams smiled. "You didn't follow the rules because you know things that aren't written in the rules. I want to make you an offer." "What kind of offer?" "Emergency medicine training coordinator position. You'll train young doctors, you'll develop trauma protocols, and when necessary, like tonight, you'll provide leadership." Sarah was surprised. "I'm just a nurse." "No," Dr. Rodriguez interjected. "You're the most talented medical professional this hospital has ever seen." "Your title doesn't matter," Sarah thought. For 15 years she had served quietly. She had hidden her past, been content with the ordinary nurse role. But tonight, her two worlds had merged. "I accept," she said finally, "but with one condition." "What is it?" "No one declares me a hero. I'm just doing my job. Used to be on the battlefield, now here." Dr. Williams nodded. "Agreed." 3 months later, Sarah's training program revolutionized the hospital. Young doctors learned not just medical techniques from her, but stress management, team coordination, and crisis leadership. Michael was now Sarah's closest work colleague. One day he asked her, "Sarah, what was it like being on the battlefield?" Sarah stopped, thought for a long time. "Very difficult, Michael. You could lose friends every day. Every patient's story was full of pain. But at the same time, there you learned how strong humans can be, how much they can sacrifice. Do you regret it? Coming here? Remember, I'm fighting here too, against disease, death, pain. Just the enemy is different." "And civilian life?" Sarah smiled. "Michael, there's no such thing as civilian life. There's service. Only the form changes." That day when Sarah went home, she looked in the mirror. For 15 years she had hidden herself, but now she embraced both identities. Combat medic Sarah and nurse Sarah were actually the same person. She just used different tools. And the next night, starting her shift, Dr. Rodriguez asked her, "Sarah, if a situation like that happens again, are you ready?" Sarah answered while disinfecting her hands, "Doctor?" "Rodriguez, I'm always ready. This is my job." Dr. Rodriguez smiled. Now he knew Sarah wasn't just a nurse. She was Memorial Hospital's secret guardian angel, an angel from the battlefield. And from that night on, in every critical case at the hospital, doctors said the same thing. Call Sarah. Because some people are born to serve. On the battlefield or in the hospital, it doesn't matter. What matters is saving lives. Sarah Mitchell was exactly that kind of person, a silent hero, a hidden warrior, and above all, a perfect nurse. So now I ask you, have you ever met someone like this? Someone who seemed ordinary but had an extraordinary past? Write their names in the comments, share their stories, because at Hidden Legends, we believe in giving voice to the stories they carry quietly. If this story touched you, subscribe, share, and help keep these voices alive. We'll see you in the next one. And until then, if you see a nurse working quietly in a hospital, remember, sometimes the greatest warriors have the gentlest hands. And remember, true heroes don't always wear uniforms. Sometimes they wear scrubs, carry stethoscopes, and save lives with the same precision they once used to save soldiers. Hit that notification bell. because legends like Sarah deserve to have their silence honored with our attention.